12 o'clock on my phone, so I'm going to go ahead and get started. Thank you, everyone, for joining us today for our Friday federal COVID-19 update. And today we have a special guest with us. We have Saundrea Shropshire, who is the Senior Legislative Assistant for Representative Jim McGovern. So we're really excited to have her here today, especially because the House just introduced the fourth COVID-19 package. So we'll go ahead and get started. For those, I hope you are all familiar with the ARC. Just go through it real quick. We are an umbrella organization, and we have 17 chapter affiliates, and we work with provider, government, and advocacy agencies. And our mission is to enhance the lives of people with intellectual and developmental disabilities, including autism and their families. For today's agenda, as I mentioned, we have Saundrea, so I'm going to call her Drea Shropshire. She is going to provide a House update on the HEROES Act, which is the fourth COVID-19 package. And then we'll just talk a bit about the We Are Essential campaign, and we need to continue it towards the Senate because the House is voting today. So our focus should be on the Senate moving forward. And then we have a few other federal updates and questions. But I'm going to stop after Drea speaks, and we'll open it up for questions after that. So please keep your phone muted, and we'll go ahead. Thank you so much, Drea. Thanks for joining us today.
Sure, thanks for inviting me. And just to kind of go over some of the points that Ellen's already made, my name is Saundrea Shropshire. I'm a senior legislative assistant in the Office of Congressman Jim McGovern. He's the representative for the 2nd District of Massachusetts. I've worked for the McGovern office for going on 2 years this July. And I cover issues related to hunger, food insecurity, education, and judiciary. The House is currently voting on the HEROES Act, as Ellen mentioned. They have some very strict social distancing kind of placements so that the members are voting in 6 different groups. I believe there's going to be kind of the larger vote later on at 5 today. And pardon, you'll likely hear a lot of notifications while I'm speaking because all of my emails are coming into my work computer. So the past few weeks have been super chaotic, but we are generally pleased with the Speaker's version of the bill. I know that on March 18th, the ARC sent a letter to every congressional office that marked their COVID legislation goals and priorities of those. I know that there was one of the goals was a 6.2 increase in the federal reimbursement for FMAP. One of them was emergency requirements for all health insurers to cover testing. Another was expanded nutrition assistance, which Congressman McGovern was largely the champion for over on the House side. Another was expanded unemployment insurance. And the last one was limited paid sick day and paid leave provisions. In response, the HEROES Act, and these are just kind of overall provisions, included dependent care assistance. So for example, all dependents, including adult dependents and full-time students under the age of 24, are now eligible for the $500 qualifying child amount. There was an increase to FMAP starting in July 2020 that will be 14%. And then there's a required update to the testing plan that'll identify types of testing necessary to monitor and control over the pandemic, specific plans and benchmarks with clear timelines on how to ensure sufficient availability and allocation of testing materials and supplies, sufficient lab personnel capacity. And this testing really aims to include capacity for also non-healthcare settings to make testing more accessible. I know that our healthcare system is really being bogged down, and actually even saying that in itself is an understatement. And there's also going to be a requirement for the Secretary of HHS to establish and keep a public searchable website of all tests that are used in the United States. HEROES also included $7.6 billion for health centers for underserved populations, and a total of $3 billion in provisions for food assistance. throughout the COVID kind of pandemic or the past 2 months. Congressman McGovern has championed, like I said, issues related to SNAP and food insecurity. The congressman believes that the access to healthy, nutritious food is not just a human right, but also one of the social determinants of health. And I think the COVID pandemic is showing us the importance of being proactive rather than reactive with our country's social safety net programs. He says this a lot, but if we prioritize things like SNAP and unemployment, education, and healthcare earlier, it's very possible that the country would not necessarily be playing catch up in the way that it is now. Throughout the COVID pandemic, the congressman has also continued to take a lead in the House of Representatives through the House Hunger Caucus. There have been some really unique challenges during the pandemic, especially when it comes to SNAP in particular. There's been a focus on expanding overall SNAP provisions during the pandemic and another focus on online SNAP implementation. I think especially in the first month, there was a really big push for the state of Massachusetts to be more involved in that and to kind of get the ball rolling so that we could be one of the states that was implementing the online SNAP pilot. So in terms of, and the reason I'm going to speak most heavily on SNAP today is because obviously that's the congressman's kind of one of his largest issues, and that was one of our biggest pushes in the HEROES Act. Part of what made this pandemic so difficult from a food security perspective, particularly for seniors and persons with disabilities, is the need for minimum contact grocery shopping. So for example, folks like seniors and persons with disabilities oftentimes face higher risk for COVID and they need safer access to grocery stores. And with regards to that, we actually, especially in the beginning of April, teamed up with the Nutrition Subcommittee, Chairwoman Marcia Fudge, and sent a letter to USDA asking essentially for what USDA was doing during COVID regarding online SNAP and for a list of states that had indicated interest. And that's something that we've been working on for a long time. And USDA responded to our letter pretty quickly. And basically, since then, Massachusetts has sent in a request for online SNAP, like an online SNAP waiver. As of recent, I'm not sure if that's been granted quite yet, but it looks like once it is granted, there would be like a 2 to 4 month minimum of implementation. And it's really interesting because a lot of stores are playing catch up. A lot of grocery stores specifically are playing catch up in what what their capacity is. So a lot of them are focused on just keeping stock in their stores and making sure that their employees are protected and things like that, and don't necessarily have the capacity to implement things like online SNAP at the time. So we'll likely see, what we hope to see is within the next 2 to 4 months that's starting to be implemented in the state of Massachusetts. And then essentially our overall SNAP provisions that were included in the HEROES Act were boosting the maximum SNAP benefit by 15%, increasing the monthly SNAP minimum from $16 to $30, and then putting a place on the proposed rules. There were 3 proposed rules that the Trump administration put out in the past year. One of them was on able-bodied adults without dependents. The other was categorical eligibility. And then the last one was standard utility allowance. Essentially, the HEROES Act asks that these proposed rules all have a stay or a pause put on them, I believe for the next 2 years. We were pleased to see all of those things included in the speaker's bill. But in terms of, whether we expect them to be, included in the final version of the bill that goes through the Senate, I think we're kind of preparing ourselves for a fight on that end. And the reason for that is we've essentially seen SNAP provisions kind of stonewalled by, Republican leadership and by the president's leadership for the past couple of months, right? And we've been pushing to get these SNAP provisions in our bills for the past few versions of the COVID stimulus packages, and we've seen them largely left out of the equation. The congressman has said this multiple times, but he doesn't know that how he could vote for a bill that doesn't have SNAP provisions in the final version. And we're really just kind of holding our breath and waiting to see what happens. So in terms of, I guess I'll end on what I think in ways that I think groups like the ARC can be helpful. I think it's really helpful to ask that members of the delegation in Massachusetts stay focused on issues like SNAP. In the final version of HEROES, we don't have all the power, and by we, I mean Democrats don't have all the power in the government right now, but we do have some. And I think that we are in largely a position to demand whatever provisions we need. And I think, you know, SNAP is one of those big pushes that we need to be making. Obviously, you know, we can do all that we can to, you know, have our healthcare system, but if we're not taking the preventative measures to essentially keep people out of our healthcare system, or keep people from going to the hospital when they're sick rather than taking preventive measures, we're going to be in trouble. And I think it's also another way that groups like yours can be helpful is by activating your networks in sister states that have Republican representation. For example, reaching out to your state level Republican leadership to let them know how important certain provisions in this current bill are for you, crowding their inboxes, doing things like flooding their phone lines, letting them know essentially how important some of these provisions are to you and how important it is that they are included in the final version of our bill. Our biggest hurdle right now essentially is leadership that doesn't, you know, prioritize the same provisions that are in this bill. And it's largely likely going to be the case that groups or you know, representatives that are opposed to these try to take them out and either soften the language or give them less money or things like that. So it's really important to make sure that your voices are heard in this space. But that being said, that's kind of all that I have to say, or at least the meat and potatoes of it. And I'd be happy to take questions once Ellen goes over the rest of the PowerPoint.
Okay, thank you so much, Drea, and we appreciate all that Congressman McGovern's been doing, and especially around SNAP. I mean, I know he's been a leader for many years around this issue, so it's really great to see all this in the fourth package. I mean, we can open it up for questions right now if you'd like. I mean, we set it up in a format for Drea just to speak about all the issues around what she's covering specifically, but also what's in the package. And then I created some slides that were, you know, that I wanted to focus on, just make sure that we covered what is in the bill that is impacting the disability community. And there's a lot of stuff in it. So I got some very high level things. We have a brief update from the ARC of US that we'll share on our website and social media as well, and more details will come out in the coming weeks. But I wanted to make sure that we had them on, a few of them on these slides. So I can open it up to questions right now if people would like, otherwise I can keep going. It looks like there's a question on the census. Many residents get replacement. So if you can certainly do that online. If you had a problem with your census and you want to resubmit it, you can resubmit your census form online. There are procedures that the census has in place to resolve any duplicate submissions. So if that's the issue, you certainly can resubmit it. I would encourage you to do it online. As opposed to getting the forms, you can call, and then there's a number to call as well to get it mailed, but that's what I would recommend. Are there any other questions for Drea right now? And we can wait until the end. We can cover it at the end as well. So just to go over a bit of what Drea's covered most of this with the FMAP bump, which is a huge, you know, that was huge for us. That was something that we've wanted all along. And so we're getting an additional 14% FMAP increase, and that includes an HCBS, a home and community-based specific FMAP increase, an additional 10% that's going directly to home and community-based services, which would include money for the workforce, direct support workforce, personal protection equipment for direct support professionals, and other home and community-based service provisions. And then I'll just reiterate what Drea had mentioned about the stimulus payments. which is another win for us. That was an ask that we've been pushing for a long time, that it's extended to adult dependents. And there's going to be a second round of payments. So it's not just going to be the $500 credit. People are going to be receiving the full $1,200. And the paid leave provisions expanding not just to parent family members caring for adults with disabilities, but including a broader definition of family members to get paid leave as well. And you mentioned SNAP. I'll just repeat that the DSP workforce is considered essential workforce for hazard pay and overtime in the bill. There's a lot of great housing and transportation provisions, including a broad uniform 12-month eviction moratorium. As far as education, there's an additional $100 billion to support education needs of states and school districts, and which could include IDEA. And there's money for technology needs, $1.5 billion for broadband access, and $4 billion for emergency home connectivity needs. And as far as disability rights, it provides standards for absentee ballots cast by mail and ensures that absentee ballots and related voting materials are accessible to voters with disabilities. It also requires the CDC to establish field studies to better understand the health inequalities that are health inequities that are not currently tracked by the Secretary of Health and Human Services, and provides funding to modernize data collection methods to include collection on disability disparities. And then for the census specifically, it pushes, so it makes it official, basically. This is something the Census Bureau had asked a few weeks back, but it pushes back their statutory deadlines so that the count for establishing to publish apportionment and state redistricting data is extended to 4 months. And then it mandates that the census has to provide count progress updates to the House and Senate, and it also gives them an additional budget of $400 million. So that is a lot, and it was a very quick update. And I think in the next coming weeks, we'll be providing additional details on a lot of those provisions, but I just want to make sure you guys knew that there was a ton in this bill that's being covered for the disability community, and it helps with a lot of the, I mean, it's a lot of the asks that we've been pushing for our community has been pushing for. And so it's really great to see this in the House, but, you know, as Drea mentioned, it's going to be a huge lift to get this passed in the Senate. And so we really need the pressure on to make sure that the Senate views all of these same priorities as the House did. And we're pretty sure that the House is going to vote for this, right, Drea? I mean, that's not a question.
Yes, so we do expect the bill to pass in the Senate largely on a party line vote. So. Okay. All right. Or sorry, did I say in the Senate? I meant in the House. We expected to pass in the House on a party line vote. My apologies.
Yeah. No worries. I think, we got it. So I just want to remind everyone about our collection tool that we have, and that we have all of those great images and graphics to use for our We Are Essential campaign, and to continue using the action alerts that with the ARC of US has prepared, and the ARC of Mass has been circulating on social media and through email. We got to keep the pressure on. So I just wanted to let everyone know, in case you hadn't seen, the U.S. Department of Education's Rehabilitation Services Administration has issued guidance on vocational rehabilitation services. And so I've provided the link here, but basically it's just making sure that that their services are continuing, and that they can be used either through telephone or online or other alternative means in replacement of face-to-face ongoing support services. and they must continue in good faith and reasonable efforts to provide pre-employment transition services to students with disabilities based on their needs. So that was just issued on May 14th, so I just wanted to flag it for everyone. And then, of course, the census, as I mentioned before, so important. Our self-response rate is up to 61.3% in Massachusetts, and we're still ranked 20th in the United States. But of course, we still need to get the message out as wide as possible through all of our hard-to-count communities. And we're here as a resource for any questions you have around the census. So I'm going to stop for questions. Let's see.
Can you hear me, Ellen?
Yes.
A quick shout out to Jim McGovern, who's following proudly in the footsteps of his old boss, the late Congressman Joe Moakley. I'm so proud of what Jim has done consistently, not only now, but with the whole issue of food since he's been in office. And we could not ask for a better champion. We really couldn't.
That's amazing. I'll pass that on. Thank you. And I agree. I'm very biased though. So.
Thanks. So I see we have another question regarding increased funding for frontline direct staff. Are there any assurances that the increase will go to the attended staff and not only go to the agency? I mean, I'm not sure if that would be directly in the bill, but that's certainly something that we should be advocating for. I agree. I don't know, Drea, if you have any thoughts on that.
So I'm not sure if that would be contained in the bill language either, but just to add some perspective on that, my understanding is that because a lot of the provisions in these bills had to be pieced together in such a short amount of time, there has been an issue of there not being enough what we call guardrails, or basically directions on how the money would go out and things like that, or who it would go to. There haven't been enough guardrails in place. And I do think that is a weakness. Do we have a guarantee that the money is going to not go through the agency? No, it does typically go through the agency, and they, kind of handle disbursement and things like that. But I do think that's a valid question. So.
I understand it goes through the agency. I just know that, there was some issues before within the state with some chapter, 257, is it, Charlie? There was an increase, but it didn't really translate down to the staff in all cases. So I was just wondering if not within the bill, I understand that, but somehow or other on a state level, is there some kind of, I don't know, memo of understanding or something, guardrail, I love that term, that we can get ahead of to make sure that the money actually goes to the intended?
I mean, sorry, I thought you were talking about as far as like the federal language, but in Massachusetts, I can say that we've definitely advocated for that. The ARC of Mass has, spoken directly to the DDS and Mass Health about that issue. So that is, but I don't know if there has been any guidance directly on that. And Charlie, I don't know if you can correct me.
No, I don't know.
That's been issued.
Yeah.
Okay, but we'll follow up with that question.
Yeah, who would the guidance come from? Would it come from Mary Lou or the governor, about that?
Yeah, I would think that it will come from HHS or direct, or through each agency, either DDS or Mass Health.
I don't begrudge them their admin fee, and those vary, some lower, some higher, depending on the agency. I just would hope that somebody's thinking about a guardrail, I love that, so that the intended recipient gets the bulk of that gesture.
Right. No, I agree. Absolutely.
Hi, this is Carrie. I just wanted to remark too that many agencies are are already paying people what they call hazard pay. So they're increasing their rates for the direct support staff that are working, in residential and in homes and that sort of thing. So it's a fairly common practice, and I don't know if there's any other providers on the call who want to remark on that as well.
Yeah, Carrie, this is Mike Maloney from HMEA. Hello.
Hey, Mike.
And let me just say that we are paying at levels that we can't afford because we want to keep people safe. So people who work in our quarantine homes are making $24 an hour. And in our isolation center, they're making $27 an hour. We're currently being reimbursed by the state for a lot less than that. So our mission is to keep people we support and staff safe, even if it means running big deficits. So those are really hefty rates that we've passed on to staff who are doing the great work, who are courageous. We have about 25 staff who are COVID positive, one man on a ventilator for 4 weeks. So we realize as providers the seriousness of the situation, and we're all stepping up to pay more.
Great. Thanks, Mike. It's helpful.
Thank you, Mike. So for, I see there's another question. Is there any, are there any provisions for increased stipends for AFC programs? So that would be a state issue. So that's not related to this federal COVID-19 package. But I will say that that is something that we're, of course, advocating for at the ARC on a state level. So, but I don't know of any provisions as of yet for increased stipends around AFC. And Mike, I don't know if you can speak to that either.
Yeah, I really don't have any more information on that.
Okay. And there's a comment from Christine Hubbard. The PPE expenses are also very high. Staff is also working lots of overtime at overtime rates to limit number of different people in group homes. Thank you, Christine, for your comment. So do we have any other questions?
Hi, it's Laurie Medeiros again. Just one other question. When it seems like folks are waiting a long time on SSI, when those SSI stimulus payments actually arrive, for folks who are in group homes and perhaps the group home manages that stipend, has there been any conversation about how that $1,200 will actually go to benefiting, their loved one? I mean, the person served.
So they should get the direct, just in the same way they get their SSI payments, they'll get that, the stimulus payment comes that the same way. So they should be getting it directly.
No, I understand that. I understand that.
However they want.
My question was more about sometimes agencies are the rep payee for that loved one. And suddenly the individuals are going to have this nice bump of $1,200. So I'm just wondering if there has been any talk or guidance about how that $1,200 can go to benefit that person directly. And, clearly what's behind that is I would want to make sure that they get the benefit. You know what I mean, of the $1,200.
Absolutely. Yeah, I don't know about any guidance for that, but that's an important question. I can check with Maura and Leo about that. But I mean, I would think that just like everyone else, they should be able to spend it as they choose, and so it would be, it's open to a lot of different ways of spending it. So I'm not sure about that question, but I'll look into it.
Yeah, because
Thank
I would appreciate that conversation at least happening, and hopefully and ultimately some sort of guidance or regulations around that. I don't know, we can impose regulations, but for folks who necessarily aren't making their own choices about their own dollars, yet they're receiving it, you know, I was just wondering if there's any conversations happening about what the folks who are their rep payee are going to be doing with the $1,200 newly allocated to the person served, you know.
Yeah, I mean, I would assume it would be similar to what would be already in place if that was the case, you know. I think, however, they're authorized to use the money, you know, before the stimulus payment came in, you know, as an issue. Like, I think it would be, I would assume it would have already been set up of how money would be spent towards helping that individual. But I that's something I can get, you know, I can check on as far as, you know, how it would be different with a stimulus payment. But thank you for the question. All right, well, it looks like it's 12:30 already. Can try to do one more question if we'd like. Otherwise, I think we're done. But thank you so much to Drea for joining us today. I really appreciate your perspective, and we appreciate all the things that your office is doing and the leadership of Congressman McGovern. So thank you, Drea. And thank you, everyone, for joining us today.
Thank you.
Hope you get out and enjoy the nice weather this afternoon. Have a good weekend. All right.
Have a good weekend.
Thank you.
Take care.
Thank you.
Bye.
Thank you.